Hello, welcome everyone. Welcome to the latest monthly briefing, the first of the 2017 financial year. It won't have escaped your notice that there are so many changes on the horizon for us at the moment, and I'll be taking some time in this briefing to talk about some of the changes coming up for our trust. We'll also hear from Simon Truelove, our Finance Director, about the financial position. We ended the year with a deficit, and he'll be talking about that and the year ahead. First of all, I want to talk about our CQC inspection, which is coming up at the end of June. We have made so much progress since their last inspection, and we have brought in so many changes to improve our services and to monitor how our services are running. There is so much to show the inspection about the quality of what we do, not least that quality is part of our thinking every day. Having an inspection is another chance to show it. We will be sharing a lot of information in the weeks running up to the inspection to make sure that you feel prepared to meet CQC inspectors. But if there's one thing I want to say to you, it's to feel proud of what you do and to show the CQC inspectors how proud you are of your work. Take a moment to stop and think about the things that you do every day to improve patient care. What's really special about your role? How do you help your team to have great patient outcomes? We all play our part, and whether it's in creating a good care plan, whether it's involving service users and carers, whether it's creating a great working environment, or whether it's helping somebody to be treated closer to home. When the inspectors visit your area, don't let them leave until you've told them something great about what you do and about how your team works. The CQC programme team is led by Phil Cooper, so if you have any questions, ask Phil. As I've said, lots of information will be coming your way as we approach the 23rd of June. But there are some steps that you can take now. Read the Preparing for the 2017 CQC Visit booklet. This describes what happens during a CQC visit and answers the question staff often ask. Think about the environment in which you deliver care. Are there any issues which need to be addressed or reported, tidied or cleaned? Think about your practice and your caseload. Are there barriers to delivering great care? If so, discuss with your line manager. Are there solutions we can find? Check that your case notes and care plans are up to date and reflect service user involvement and carer engagement. Make sure you're up to date with statutory and mandatory training. Meet with your team and make sure you all know what your team's quality priorities are and how you are achieving them. If you have any queries or concerns, please talk to your team manager, your quality director, or contact the CQC team. No question is too small. Transformation. Having ended the year with a deficit, as we expected, we naturally need to look at how we deliver our services in the year ahead. The message is really clear. As for the NHS at large, if we are to be a sustainable organisation, there will have to be some major changes. We all know the financial climate we operate in and the demands that are placing and increasing upon our services. It's not enough to continue to do what we currently do in the same way that we do it. So this year, we're taking a fundamental look at what AWP Trust does. What we do really well, what we should do more of, and crucially, whether there are things that we should stop or do less of. Significant change will come about as a result of this work. I know that for some people, change can be really unsettling, and I want to assure you that I and the executive team and the board recognise that you as the AWP staff have most of the ideas for change, have most of the ideas around new models of care. You may have ideas about how we can deliver services in places where we have challenges, for example in recruitment. At this stage, we're truly open to hear your ideas for change. I want you to feel that you can be part of those conversations and also part of the way we're continuing to change the culture of our trust. I want you to feel proud of working for this trust as I do, proud of your colleagues, proud of being part of something that makes such a difference to so many people. This year we're going to be part of something called Listening into Action. This is an evidence-based process for staff engagement and generating ideas. This will be the way in which we discuss challenges and come up with solutions. Simon is going to talk now about the financial picture and another new approach which will help us with this transformation.
So hello, my name's Simon Truder, for those who don't know me. I'm the Finance Director for AWP. I'm here to talk about the difficult financial sort of picture that AWP finds itself in. For the financial year 2016-17, we ended up with an £8.9 million deficit against a turnover of £217 million. We've seen many pressures on our sort of financial position, many of which relating to our workforce and the increased use of agencies and bank nursing across the organisation. But we've also seen sort of pressures within our sort of estates, the cost of running some of our sort of units have been expensive, and this is all added to the financial pressures of the organisation. We're also moving into 2017-18 in a difficult financial position. We're faced with a £20.5 million sort of financial gap, which the board have been working through very sort of prudently. We've identified about sort of £12 million worth of savings, but we've still got a gap of between £8 and £9 million. And to that extent, we've been asked as an executive team to look at further opportunities and to really sort of consider, new models of care, transformation, as Hayley's talked about, to be able to see sort of whether we can actually close the financial gap. And to do this, we've been working with NHS Improvement, and we have voluntarily sort of been included in a financial improvement programme, which will see us working with an organisation called SSG Health to be able to bring in additional capacity who work with us and for us in respect to trying to close the financial gap. We will also, as should all organisations in the NHS, be focusing on sort of the quality of our services. But it is absolutely important that we balance quality and finance at all times. And therefore we are going and moving into a time of real sort of difficultness, where I will need people to be thinking about what we're spending our money on, looking at the opportunities to be able to save resources, and really thinking hard about, do we really need it's every single item that sort of we're asking for. It is really important that we don't waste resources and waste our precious financial resources which we are given by our sort of commissioners. And we need to make sure that we maximise our recruitment and retention of our staff, so that we don't need to have so much reliance on agency nurses and agency doctors. And where possible, looking at the way that we do things, if vacancies occur, then we look to see whether they can actually be done, that work can be done in a different way. So I hope you will sort of, will work with us as an executive team on behalf of the organisation to be able to actually respond to this huge financial challenge that we've got. And hopefully over this next year and into 2018-19, we can bring the organisation back into a sort of financial balance. Thank you.
I hope you'll join with me in feeling excited about the year ahead. We've come so far even since our last CQC inspection, and I know there's so much more we have to do. But we have an opportunity to evolve, and I hope that you will take the opportunity to be part of the process that will help us become the organisation we want to be. Thanks for joining me.